Hi, for future nursing students. So I thought this week one of the PowerPoints that I would talk to you about and show you would be about the general survey, and I've decided to make it an online one that you can review on your own rather than taking up time in class. We're also going to be talking about skin, hair, and nails in class and going over some wound information, and I have a little activity. So I'd kind of like to focus on some of that as well. And this is one of the subjects that you guys can kind of review on your own and look in your books at as this goes along. It's only going to be about 15 minutes, so it'll be short and sweet. So remember that the general survey is your overall first impression of the patient. It involves a lot of different things. Some of it is subjective data, some of it is objective data, and we're going to talk about that here. This is chapter 9 in your book, so if you'd like to follow along in your book, make some highlights. Things will be listed in there, and I'll be referring to pages as we go along. So there's 4 areas to the general survey. The first one is physical appearance. So when we look at physical appearance, what we think about is the specifics about the patient. How do they physically look? Some of the things that we look at with this include their age. Do they look or do they appear to be the age that they state they are? Sexual development, is it appropriate for their sex and for their age? This is one of the areas that you kind of have to be very careful with nowadays because we do have transgender patients as well. So they may state that they're a girl, but sexually developed they are a boy, or vice versa. So you have to be able to adapt to those specific changes as well. Of course, their level of consciousness. How alert are they? If you look in your book on page 127, it says the person is alert and oriented to person, place, and time. So that means that we could ask the patient who they are. So they are alert to person. They can tell us who they are. Place, where they're at, and time. It could be what the day is, or maybe the year, depending on the patient. So making sure that they're alert to those things. And then do they just generally respond and answer your questions appropriately? Next is their skin color. So we want to describe their skin color. Now, I don't want you to say white. I want you to describe that white. Is it ivory? Is it with pink undertones? If they're African American, is it like a light brown? Is it a dark brown? But be able to describe that the color of that skin a little bit more. I'm just going to pull my book over here a little bit. Overall, next would be their overall appearance and facial features. So are their facial features symmetric with movement as well? So if they smile, does the smile go evenly on both sides? Do they have something that's drooping on one side of the face? Looking at, just making sure that things line up the way that they're supposed to. It sounds silly, but is one eye up here and the other eye down here? You know, so we're looking for symmetry. Are their ears pretty symmetrical? Are they even on both sides? Or again, is one up higher than the other? Body structure is the second thing that we look at. With this, we look, of course, we measure them for their height. Their nutrition status, do they look healthy for their size? Do they look like they get a good nutrition? Is their weight and their height even as to what it should be? Symmetry, again, on both sides of the body. If they have one arm, do they have another arm? So always, that's what symmetry means. If something is symmetrical, I like to think of a circle. If you take that circle and you divide it in half, you should have 2 equal halves. So symmetry is being able to cut something down the middle and having two equal sides. Everything is the same on both sides. So if you think about the body, we could cut the body down the half, and we should have symmetry on both sides. We're also looking at posture, the posture of the patient. Are they standing erect, comfortably? Are they hunched over? Things like that. Position would be if they're sitting comfortably, are their arms relaxed? Or is their body position showing that maybe they're hunched over, they're holding something because it's in pain, that particular area. So what position do they have? Also looking at their body build as one of the body structures. Number 3 is the mobility. So we're looking at their gait. Everybody has a gait. When they walk, do they walk evenly with both legs? Or does one foot drag? Do they shuffle? Those are different types of gaits. So also, if they stand, when they're standing, are their feet inappropriate width apart? They should be equal to shoulder. They shouldn't be too far out, and they shouldn't be too far in. So looking for their stance as well. Looking for range of motion, we will be going over how to do range of motion on each of the joints. These are things that you probably have already done as CNAs as well. And looking for any involuntary movements, things like tics or tremors. Sometimes I have a little bit of a tremor. It's not too bad today, so it doesn't, but sometimes you'll see my hand having a tremor like that. Things that they can't control. Next is their behavior. Going to look at their facial expressions. Do they maintain eye contact if it's culturally appropriate for them to? If I say something funny to them, do they smile or do they laugh? So are their facial expressions appropriate to the conversation? Also their mood or affect. What does their mood seem like? Do they seem content? Do they seem happy? Do they seem sad, depressed? Are they withdrawn? Looking at their mood. Affect, a lot of times you'll hear the term flat affect. So if I were to tell you something funny and you just kind of sit there and don't make any changes in your facial expressions. Sometimes we see the flat affect with people who are on psychotropic drugs, so people maybe like with schizophrenia or some other type of a mood disorder or behavioral disorder, and those drugs can cause them to have a flat affect. Also patients with Parkinson's or other neurological disorders can have a flat affect. Listening to their speech, are they articulating their words well, or do they have problems with that, and are you able to understand them? Looking at their dress, is their dress appropriate to the weather? Now we know that there are people out there who wear shorts in the middle of the winter. We know there are people who wear winter coats in the summer, just that's the way they are. So you have to kind of gauge that according to the patient as well, but always looking to see if they're dressed appropriately. Also looking at the culture and their age group when we're looking at their appropriate dress. We've talked about, in the first class we talked about Amish and communicating with Amish. Well, know that they dress differently as well. Some Hispanics wear different clothes. If you have like an Indian culture, they wear different clothes all year round, and usually it covers, especially on the woman, it covers all their skin except for their hands and maybe their feet. So just looking to see if it's appropriate. Personal hygiene, obviously, if they take care of themselves. So when we talk about the physical examination itself, so these are things that we are going to actually touch the patient, look at the patient, not just observing and looking, but touching, palpating, listening, all of those different things. So there's 4 different assessment techniques. We have inspection, palpation, percussion, and auscultation. So obviously inspection is just looking. palpation is touching, probing, pushing, palpating. Percussion is when it's kind of, think about a drum, think about percussion as a drum, and we're listening for certain sounds. And basically you're going to put your hand on the patient, put your finger or a couple fingers, and you're going to tap your finger over certain areas. Now I don't know if you're going to be able to hear this or not, but I'm going to try it here. So if I'm doing percussion on my chest, not sure if you can hear that or not, but definitely it is a thumping sound, and you'll get used to being able to percuss different areas and know what you're going to be listening for, if it's hollow, a hollow sound, or if it's a solid sound. Auscultation is listening, listening for bowel sounds with our stethoscope, over the belly, listening for lung sounds over the chest and back, different ways of auscultating. Vital signs, obviously we're going to talk about their temperature, thermal regulation, so how well is their body able to be able to regulate the temperature of their body. So thermal regulation. Sensory skin receptors. When we talk about sensory skin receptors, there are certain areas that you're able to feel more hot and cold with. Excuse me, I'm turning my page because I want to get to the right page. This is on page 132 in your book when you talk about it. So sensory areas, sensory skin receptors, so that you're able to feel hot and cold. A lot of times when we're using our hands to feel temperature, we like to use the back of our hand instead of the front. This is more sensitive. Also, the pads of the fingers are more sensitive when we're touching and palpating. Vasodilation, so that's when the peripheral vessels, now you might want to remember these terms. Vasodilation is when we have dilation of peripheral blood vessels. Peripheral meaning everything away from the core of the body. So everything away from the trunk. So we're talking about vessels in your arms and your legs. So everything away from the trunk of the body. Vasoconstriction is just the opposite, where we have constriction or narrowing of those peripheral blood vessels. So this is a little hint for you. If I ask you what the meaning of vasodilation and vasoconstriction is, you are going to be able to tell me that it is dilation or widening of peripheral blood vessels, and that the peripheral blood vessels are the vessels in the arms and the legs, and they are away from the trunk of the body, as well as vasoconstriction, opposite. When our temperature is affected, our body may perspire. So anybody who's ever done a workout knows that the more we work out, the hotter our internal temperature gets, and to cool ourselves off, our body perspires. Shivering is another thing. If we get too cold, our body will shiver in a way to try and make us more warm. The heart rate is also a vital sign, so looking for the pulse rate, we'll be practicing that a little bit more, and then of course our respiratory rate, so how many respirations we have. Factors that influence body temperature, we have age, diurnal variations. Those are things that we look at for, say at night, your body temperature usually cools down when you're sleeping, your pulse rate slows down, your blood pressure lowers. Those are diurnal variations. Exercise can affect our body temperature, hormones can affect it, stress, and of course the environmental temperature and humidity. Illness can also affect it. Pulse. Pulse is, we have different areas that we can feel pulses. When you're doing the pulse, make sure you use the pads of the first 3 fingers. I like to use the 2 middle fingers. Those seem to be a little bit more sensitive than the index finger. If the rhythm is regular, you're going to count 30 seconds and times it by 2. If the pulse is irregular, you're going to count it a full minute. You want to assess the rate, the rhythm, the force, and the elasticity. All of those are in the book, and we'll be going over those in lab as well.